Welcome to the Gum Guru Podcast, where we uncover the truths behind your oral health, one tooth at a time. I'm Lisa Brough, your host today, and we're diving into one of the most popular dental trends out there, clear aligners. We're here today with Dr. Macon Singletary from North Raleigh Periodontics and Implant Center, and our special guest today, Dr. Mary Morgan Kaiser from Kaiser Orthodontics. So we should find out some interesting things today. They promise a straighter smile without the metal, but are they safe for every mouth? If you have gum disease, bone loss, or even a history of periodontal treatment, clear aligners might do more harm than good. Before you say yes to invisible braces, make sure you're asking the right questions, because when it comes to your smile, what you don't know can hurt you. Let's get into it. So, our first question, and I'm going to let you guys just jump in, whoever thinks they want to answer it, or maybe a combination, because you're both coming at it from different angles. What are clear aligners, and why are they so popular with adults?
Okay, well, I'll go first, because Mary Morgan, we sort of saw her last week and said, oh, by the way, we're doing this podcast on aligners, clear aligners. I'm a periodontist, so obviously I want to make sure the gum and bone and tooth structure is going to survive all the work that she does. But also I'm old school. I mean, I like the braces like they used to do. Now, that doesn't mean clear aligners or Invisalign are the way to go, and she's educated me a little bit on that. So, I'm going to let Mary Morgan tell us what she told me the other day, and maybe we just shed some light on, is it good, is it bad, and what to look for.
Yeah. So clear aligners, I tell patients all the time, it's a tool. So braces are a tool meant to move your teeth. They're kind of our tried and true and have been around for quite some time. But clear aligners have become popular in recent decades because it's a more aesthetic option. It's a removable option, and it's a way to apply forces to the teeth and move them that's stepping away from the traditional braces that we're familiar with. And I tell people they look kind of like a clear mouth guard if you've ever played a sport or worn a mouth guard, but you get a series of them and you're changing them at designated intervals to move the teeth over time. So we adjust braces to move teeth, and then we change our aligners at designated intervals to apply forces and move the teeth.
It looks like you don't need any wax for those to keep your gums from getting cut. Right?
Great point. Great point.
Remember those. So what's the risk that no one talks about, especially for adults?
Well, for adults, it's just a matter of keeping the gum tissues healthy. And obviously, clear aligners may be easier because you can take them out and brush and floss. But also, and I was asking Dr. Kaiser, I said, when you take them in and out, you're moving the teeth. Whereas braces, you have constant motion. Yes, you have to floss letters, but she explained to me that the aligners are, you keep them in most of the time. You take them out maybe to eat. And one of the advantages it probably is that you're able to floss and brush. But moving teeth through adult bone, somebody that's older, it's more denser, may take a little bit longer to do it. And so it could be a factor with the forces that need to be placed on the teeth. What do you think, Dr. Kaiser?
Yeah, absolutely. So as far as risks, Dr. Singletary and what he's looking at in his exam is so important because I'm counting on patients coming in and having a dental clearance, having the appropriate support so that we can move the teeth through the bones safely. And so if he says, yes, we've got healthy tissue, we've got healthy bone, you can move these teeth, then I have the green light to say, let's do that. But moving through adult bone is a different ball game. And so for adults, we need to be monitoring things. And so I tell patients all the time, there's a lot more control given over to you if you're doing aligners, because if you take them home and they sit on your nightstand, they're not applying any force to your teeth. But then if you decide over the weekend you're going to shove them in your mouth and they don't fit well, that's too much force. So we need light, continuous forces is what I always tell patients. And so we're really banking on them listening, which my instruction to patients is 20 to 22 hours a day with those aligners in your mouth. So you're taking them out to eat and brush your teeth, but otherwise they're in your mouth.
Or for that hinge date, I'm not,
Great. Yeah. So we have to kind of balance. There's some lifetimes when people want to take them out. And we say, well, not too much time out of the mouth.
That's how, I think about it, because I'm getting older. Do the bones grow back like they do when you're younger? I mean, is it, because you think to yourself, as they get older, are they going to grow back and keep those things solid once they move?
Well, so the forces that the orthodontist put on the teeth, there's pressure on one side, tension and pressure. To move the tooth one way, there's going to be resorption. On the other side, the ligament brings the bone with it. In periodontal disease, once the bone's gone, it's gone. And usually it's from an inflammatory nature. But in orthodontic therapy, if it's done in healthy tissue, as they move the teeth through the bone, yes, the bone remodels.
Wow, that's pretty amazing.
Yeah, and one thing I'll add, and Dr. Singletary is very good at speaking about this when we've talked about patient care, is medications that you're taking play a big role. And so adults tend to be on more medications. And if you've got females of a certain age that maybe osteoporosis is a risk, or they're taking medications that are just modifying the way bone is forming, that's a flag for me to say, hey, the way that your teeth move is going to be different than our 13 or 14-year-old patient. And so I have to sit down with patients and talk to them about what's feasible. How can we move these teeth? Because sometimes people come in with an idea of, I can have my teeth in a perfect line, but they might have some underlying medical factors or medications that'll inhibit the way that bone formation is supposed to happen during orthodontics.
I can see as an adult people wanting, for aesthetic reasons, but are there maybe medical reasons that they need to move these teeth into alignment as we get older?
Yeah. Good question. I always say you can have your teeth straight as the picket fence, and if you're not flossing and brushing correctly, it's not going to make any difference. I always say beauty is in the eye of the beholder. Function, comfort, and function, the forces of occlusion along the long axis of the teeth, all playing a factor of normal day in, day out chewing. You can have healthy gum tissue, and if you're banging on the tooth a certain way, you get a wide, what we call wide periodontal ligament space. But if there's no inflammation, you take that force away, it'll tighten back up. You have a little bit of inflammation, you're going to get bone loss. But it's the dynamic of chewing and pressure and things that the oral cavity experiences, stress. People who have sleep apnea and they're clenching during their sleep because they're trying to open the airway, can be a factor. And having the teeth appropriately aligned will help distribute the stress in a more appropriate fashion.
Yeah, I mean, he teed it up for some of your question was medical reasons or maybe less aesthetic. And I can think of two patients where Dr. Singletary does a lot of implants. There was a fellow that needs an implant in the lower posterior portion of his mouth, but the neighboring teeth had kind of drifted into that area. And so orthodontically, we can help move the neighboring teeth, make an appropriate space for an implant so that he can kind of return to normal chewing and function. But I tell people it's driftodontics when it's out of control or teeth do what they want to do. So then orthodontically, we try to recreate maybe space that has gone awry. Or if if somebody's only biting on one side, their teeth and the left side don't touch, that can really cause a lot of disharmony in the bite. So if we can help equalize things, I tell people all the time, I love when aesthetics and function go together, but we're going to prioritize your function and your health first and foremost.
So I had orthodontic work when I was young, and I imagine maybe some of your patients, are they having repeat work now done? They had orthodontia when they were young? Because I've noticed with mine, they took out a lot of teeth. Now I'm getting bigger and bigger spaces. I've noticed I don't have to... I'm not tight in there at all. I could get like your toothpicks in between all of them now. At this point, they're kind of drifting apart.
Yeah.
But do they ever have to have like work where the orthodontia originally?
Great point. Yeah. We tell people orthodontics is when we're moving the teeth, but the latter part of that is retention, which is when we talk about retainers. And orthodontics has gone through many trends of how long do you want to wear your retainers? And it's really kind of how long do you want your teeth to stay straight? My cheesy rhyme is nighttime for a lifetime if you want to hold on to the position of the teeth. But I was told to wear them, for 10 years until I finished college. And that still wasn't enough. I ended up retreating myself and actually did clear aligners the second round. But in your case, very common. If you've had teeth taken out, that space may reopen if you have nothing holding things in place. So I have a third of my patients are adults, and majority of those are retreatment cases.
Wow. Okay. That's what I had heard, because I'd heard that some people had problems with that. So why might aligners be risky for someone with gum disease or with bone loss?
Well, the teeth, as they move through the bone, if you have less bone, it's going to take less force to move them, number one. Number two, adults or any patient that has orthodontic therapy, the orthodontist is going to make sure that there's no inflammation in the gum tissue. You don't want to move teeth through inflamed gum tissue, because that can affect the bone support, the ligament. It's you just don't do it. And so generally, I always tell patients when they come in for like for recession and check what has happened, or before they have braces, and they want to make sure that the gingival tissue is not going to recede anymore because of the forces of occlusion. I tell them it's the main thing is just keep the plaque off. Maintain your oral hygiene at home. The two most important parts of maintaining gum tissue health are what you do at home daily. And I tell everybody, floss and brush 4 times a day, not twice. 4 times, and stay on a good maintenance program. But patients that are doing orthodontic therapy, you want to make sure if there's any inflammation that it's addressed prior to and then during the movement. If there's any hint of inflammation, that they're being watched and monitored. And generally, the orthodontist will say, "Hey, you better make sure you get your teeth clean." And twice a year may not be enough. It may be 3 or 4 times a year.
And I'm watching Dr. Kaiser over here shaking her head, yes, and agreeing, with Dr. Singletary. So I guess patients should really ask some questions before they get these. So what are the questions they should ask before they get aligners? And should they ask them to both of you? I mean,
yeah, it kind of, sometimes patients will come to my office because they know they want to move their teeth. And one of my first questions is, who's your general dental provider, or are you seeing a periodontal specialist? Where have you been before this? And if I'm their first stop, then I'm usually going to flag and say, this is multidisciplinary. We want to have somebody that is also monitoring and providing those cleanings we were speaking about. At a bare minimum, we want to keep those 2 times a year, every 6 months. But oftentimes we'll increase that as we're watching. Depends on people's tissue response, their health, their home oral hygiene. But I have many letters during the week where I send out and say, hey, I want to put you on a 3 to 4 month interval for your cleanings, because straight teeth, we probably already said it at this point, straight teeth are great, but healthy teeth are our priority. So if you can have healthy and straight teeth, that's the combination we're going for.
And so then what makes the periodontist essential here? I mean, they should probably, especially your patients that want to have this kind of work done.
And some patients will come in and say, I'm considering orthodontic therapy. What do you think? And sometimes I'll see a situation like Dr. Kaiser is talking about, where we want to create space for an implant or align it appropriately. I'll say, the main aspect of this is that there's no inflammation. Look at the character of the tissue. Is it thick or thin? Is there recession? Now, 3 things I look at that if somebody's going to go through ortho, or if the orthodontist has a question, should we do a graft before this? And I'll tell the patient, I said, well, the 3 things I look at: the position of the tooth, there's that bone on the front of the tooth, and the character of the gum is thick or thin. So if bone, position, and the character of the tissue. And if they strike out all 3, then I'm going to do a procedure to improve the gum tissue health, or get more keratinized or thicker gum tissue. So when they do go through movement, they're not going to lose any more tissue. Now, there's some cases where there is barrier tissue that I like to see. It's got, we call it keratinized tissue, sort of like what is in the palate. It's a white or pink, and it's thick, and it can resist movement and tooth brush abrasion. And I'm looking at a situation where maybe it's an anterior area. I think you're going to be okay, but they're worried about aesthetics. In those cases, I'll probably tell the orthodontist to go on and move the teeth, and we'll address the issue later, because there could be some recession involved with the movement that I can handle later, just as long as I don't think if there's an inflammatory component. Obviously, we want to handle that. But as long as I don't think there's going to be just significant loss of attachment because of the movement, sometimes I'll tell the orthodontist to proceed, and the patient, go ahead, do what you want to do, and then once you're done, we'll evaluate and see where you are.
Are there times in your life, like seasons of your life, when this may not be as good an idea?
Good question. I would say, thinking of the aligner journey, I've learned in my career, you want to be checking some boxes in terms of routine and ability to commit to this, because again, I'm not gluing something to your teeth and saying, come back and I'll do the adjustment. So if you are about to travel and study abroad for 6 months and you don't know what your routine's going to look like, I'll send college kids away with aligners sometimes, and they come back and they say, I didn't stick to my routine. I did not wear these. So a lot of times I'm asking some questions to get to know a patient pretty quickly to see, can we handle this routine with wearing these? And that could be adolescents, that could be adults, changing jobs, having children. There's the own risk of needing to take care of your gums during pregnancy, but even after, if you have a newborn. I have 2 young children. That's a hard time to stick to a routine. So the compliance component of the aligners is key, in addition to having the baseline health that we want before we move teeth.
That sounds like good advice, because I know when I was in my early 20s and I had my braces on, it's a good thing they were on there, because I don't think I would have complied. So as we're getting to the end of this, it says, what is your biggest advice in one sentence?
Well, I would say my thing, I'll let Dr. Kaiser say hers. I said, beauty is in the eye of the beholder.
Okay.
That's good. That hits home. I would say, like we kind of hinted at it earlier, and I still stick with it, that the straighter smile does not need to come at the cost of the healthy one. And so I really appreciate that we have a multidisciplinary approach here, and think that's so key to any tooth movement, but especially clear aligners.
And we always end our Gum Guru things with some sort of homework. So Dr. Singletary, do you have any homework for us, or maybe you have homework for them to think about?
Well, I mean, if anybody's considering moving their teeth, obviously they ask the right questions and get a good consultation prior to it, rather than going online and chat GPT or Googling.
My best friend.
Oh yeah, off-site places where you can get something out of an office. Just from a box. You don't want to do that.
Yeah, I'm going to echo, because there's direct to consumer has become a big thing in every world of products, and there is the ability to order some clear aligners online, and we've, as a dental profession and the dental societies, have done a good job of trying to educate the public. But if you walk away from this podcast with anything, make sure you're including the dental professional in the treatment planning process.
Super. Well, thank you both so much, and thank you all out there for joining us on the Gum Guru. The clear aligners can be a great tool, but only if your gums and bones are strong enough to support the journey. Before jumping into any orthodontic treatment, as they both said, especially an adult, ask the right questions. And don't forget to include your periodontist in the conversation. Your smile depends on it. If you found this episode helpful, be sure to subscribe, leave a review, and share it with someone who's thinking about aligners. Until next time, brush well, floss smart, and stay curious about your gums.